Ready to test your NCLEX skills? Here are 10 must-know questions to boost your prep. Tap the link card to join our free NCLEX practice challenge and keep leveling up. Let's get started. A nurse is caring for a patient who is receiving a diuretic for heart failure. The nurse notices that the patient is complaining of dizziness, muscle cramps, and weakness. What should the nurse assess next? A. The patient's blood glucose levels. B. The patient's potassium levels. C. The patient's blood pressure. D. The patient's oxygen saturation. The correct answer is B. The patient's potassium levels. Rationale for correct answer. Dizziness, muscle cramps, and weakness are common signs of hypokalemia, which can occur with diuretic therapy. The nurse should assess the patient's potassium levels to determine if this is the cause of the symptoms. Rationale for incorrect answers. A. The patient's blood glucose levels. Hypokalemia is more likely the cause of the symptoms than an issue with blood glucose. C. The patient's blood pressure. While blood pressure should be monitored, the priority is to assess potassium levels, especially when the patient is on a diuretic. D. The patient's oxygen saturation. Although oxygen saturation should always be assessed, the immediate concern is hypokalemia. CliniqueRN Test Day Tip. Monitor potassium levels closely in patients receiving diuretics, as hypokalemia can lead to life-threatening arrhythmias. Question 2. A nurse is caring for a patient with end-stage liver disease. The nurse should be aware that the patient is at risk for which of the following complications? A. Hyperkalemia. B. Hypoglycemia. C. Hepatic encephalopathy. D. Hypernatremia. The correct answer is C. Hepatic encephalopathy. Rationale for correct answer. Hepatic encephalopathy occurs when a liver is unable to detoxify harmful substances, leading to a buildup of toxins like ammonia in the blood. This is a common complication in patients with end-stage liver disease. Rationale for incorrect answers. A. Hyperkalemia. Hyperkalemia is more commonly seen with renal failure, not liver disease. B. Hypoglycemia. Liver disease can cause hypoglycemia due to impaired glucose production, but hepatic encephalopathy is more directly associated with liver failure. D. Hypernatremia. Sodium retention can occur, but hepatic encephalopathy is a more specific complication to monitor in liver disease. CliniqueRN Test Day Tip. Always assess for signs of hepatic encephalopathy in patients with liver disease, as it can progress rapidly and lead to coma. Question 3. A nurse is caring for a patient with chronic kidney disease, CKD, who is receiving erythropoiesis-stimulating agents, ESAs. The nurse should monitor the patient closely for which potential adverse effect of ESA therapy? A. Hypertension. B. Hyperkalemia. C. Hypokalemia. D. Hypoglycemia. The correct answer is A. Hypertension. Rationale for correct answer. Erythropoiesis-stimulating agents, ESAs, can increase red blood cell production, which may result in an increase in blood volume and subsequently lead to hypertension. Rationale for incorrect answers. B. Hyperkalemia. ESA therapy does not typically affect potassium levels directly. C. Hypokalemia. ESA therapy is not associated with low potassium levels. D. Hypoglycemia. ESAs do not have an effect on blood glucose levels. CliniqueRN Test Day Tip. Monitor blood pressure regularly in patients receiving ESAs, especially in those with CKD, to prevent hypertension and related complications. Question 4. A nurse is caring for a patient who is prescribed digoxin. The nurse notes that the patient's heart rate is 48 beats per minute. What is the nurse's priority action? A. Administer the digoxin dose as prescribed. B. Withhold the digoxin dose and notify the healthcare provider. C. Increase the digoxin dose to improve cardiac output. D. Encourage the patient to rest to improve heart rate. The correct answer is B. Withhold the digoxin dose and notify the healthcare provider. Rationale for correct answer. Digoxin can cause bradycardia, especially in high doses or if the patient has an underlying conduction disorder. A heart rate of 48 beats per minute is too low, so the nurse should withhold the medication and notify the healthcare provider. Rationale for incorrect answers. A. Administer the digoxin dose as prescribed. Administering the medication could worsen the bradycardia. C. Increase the digoxin dose to improve cardiac output. Increasing the dose could be dangerous and worsen bradycardia. D. Encourage the patient to rest to improve heart rate. Rest is helpful, but the immediate priority is to assess and adjust the digoxin therapy. CliniqueRN Test Day Tip. Always check the heart rate before administering digoxin. Hold the medication if the heart rate is below 60 beats per minute and notify the healthcare provider for further evaluation. Question 5. A nurse is caring for a patient who is receiving chemotherapy and is at risk for infection. The patient develops a fever of 101.2 degrees Fahrenheit 38.4 degrees Celsius. What is the nurse's priority intervention? A. Administer an antipyretic as prescribed. B. Draw blood cultures and administer broad-spectrum antibiotics. C. Apply a cooling blanket to reduce the fever. D. Notify the healthcare provider of the fever. The correct answer is B. Draw blood cultures and administer broad-spectrum antibiotics. Rationale for correct answer. Chemotherapy suppresses the immune system, and fever in such patients can indicate a serious infection. Blood cultures should be drawn to identify the pathogen, and broad-spectrum antibiotics should be administered immediately to prevent sepsis. Rationale for incorrect answers. A. Administer an antipyretic as prescribed. Antipyretics may help lower the fever, but the priority is to identify and treat the underlying infection. C. Apply a cooling blanket to reduce the fever. While helpful for symptom relief, it does not address the underlying cause of the fever, which could be an infection. D. Notify the healthcare provider of the fever. Notification is necessary, but immediate action with blood cultures and antibiotics is the priority. CliniqueRN Test Day Tip. In immunocompromised patients, always treat fever aggressively with culture and antibiotics to prevent sepsis. Do not delay antibiotic administration. Question 6. A nurse is caring for a patient who is receiving warfarin therapy. The patient's most recent INR is 3.5. What is the nurse's priority action? A. Administer the next dose of warfarin as prescribed. B. Withhold the warfarin and notify the healthcare provider. C. Increase the dose of warfarin to bring the INR into the therapeutic range. D. Administer vitamin K as prescribed. The correct answer is B. Withhold the warfarin and notify the healthcare provider. Rationale for correct answer. An INR of 3.5 is slightly above the therapeutic range of 2 to 3, placing the patient at increased risk for bleeding. The nurse should withhold the warfarin and notify the healthcare provider for further guidance. Rationale for incorrect answers. A. Administer the next dose of warfarin as prescribed. The dose should be withheld due to the elevated INR. C. Increase the dose of warfarin to bring the INR into the therapeutic range. Increasing the dose would increase the risk of bleeding. D. Administer vitamin K as prescribed. Vitamin K may be necessary if the INR is significantly elevated, but is not required unless the INR is dangerously high. CliniqueRN Test Day Tip. When a patient's INR is elevated, always consult the healthcare provider to determine whether to adjust the dose or administer vitamin K to reverse anticoagulation. Question 7. A nurse is caring for a patient who is receiving an opioid for pain management. The nurse notes that the patient is becoming increasingly drowsy but is still alert and oriented. What is the nurse's priority action? A. Increase the opioid dose to ensure adequate pain control. B. Monitor the patient's respiratory rate and level of consciousness. C. Administer an antidote to reverse the opioid effect. D. Encourage the patient to take deep breaths to improve oxygenation. The correct answer is B. Monitor the patient's respiratory rate and level of consciousness. Rationale for correct answer. Drowsiness can be a sign of opioid oversedation. The nurse should monitor the patient's respiratory rate and level of consciousness to detect signs of opioid-induced respiratory depression. Rationale for incorrect answers. A. Increase the opioid dose to ensure adequate pain control. Increasing the opioid dose could further depress the patient's respiratory function. C. Administer an antidote to reverse the opioid effect. An antidote is not necessary unless the patient's respiratory rate drops significantly. D. Encourage the patient to take deep breaths to improve oxygenation. While this is helpful, monitoring for respiratory depression is the first priority. CliniqueRN Test Day Tip. Always assess respiratory function when patients are receiving opioids. Monitor for signs of oversedation, which can lead to respiratory depression and other complications. Question 8. A nurse is caring for a patient with acute pancreatitis. The patient is experiencing severe abdominal pain and has a fever of 101.5 degrees Fahrenheit, 38.6 degrees Celsius. What is the nurse's priority action? A. Administer an analgesic to relieve the pain. B. Administer antibiotics to prevent infection. C. Encourage the patient to eat small, frequent meals. D. Assess the patient's hydration status and monitor for complications. The correct answer is D. Assess the patient's hydration status and monitor for complications. Rationale for correct answer. Acute pancreatitis can lead to dehydration due to fluid loss, and the priority is to monitor the patient hydration status and assess for complications such as shock or organ failure. Rationale for incorrect answers. A. Administer an analgesic to relieve the pain. Pain relief is important, but the first priority is assessing hydration and monitoring for complications. B. Administer antibiotics to prevent infection. Antibiotics are not routinely used in the treatment of acute pancreatitis unless there is evidence of infection. C. Encourage the patient to eat small, frequent meals. The patient should be kept NPO initially to allow the pancreas to rest. CliniqueRN Test Day Tip. For acute pancreatitis, prioritize monitoring for complications like dehydration and organ failure. Pain relief is important, but should follow the stabilization of the patient's fluid status. Question 9. A nurse is caring for a patient with chronic kidney disease, CKD, who is receiving erythropoiesis-stimulating agents, ESAs. The nurse should monitor the patient for which of the following potential adverse effects of ESA therapy? A. Hypertension. B. Hyperkalemia. C. Hypoglycemia. D. Hypocalemia. The correct answer is A. Hypertension. Rationale for correct answer. ESAs can cause an increase in blood pressure as they stimulate red blood cell production, which can increase blood volume. Rationale for incorrect answers. B. Hyperkalemia. Hyperkalemia is not typically associated with ESA therapy. C. Hypoglycemia. Hypoglycemia is not a side effect of ESA therapy. D. Hypocalemia. ESA therapy does not directly cause hypocalemia, though calcium and phosphate balance should always be monitored in CKD. CliniqueRN Test Day Tip. Monitor blood pressure regularly in patients receiving ESAs, particularly in those with CKD, to prevent complications like hypertension and stroke. Question 10. A nurse is caring for a patient who is receiving total parenteral nutrition, TPN, through a central venous catheter. The patient develops a temperature of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. What is the nurse's priority action? A. Administer an antipyretic medication. B. Draw blood cultures and notify the healthcare provider. C. Increase the TPN infusion rate to flush the line. D. Apply a cooling blanket to reduce the fever. The correct answer is B. Draw blood cultures and notify the healthcare provider. Rationale for correct answer. Fever in a patient receiving TPN may indicate a bloodstream infection, often related to the central venous catheter. The priority is to draw blood cultures and notify the healthcare provider for appropriate treatment. Rationale for incorrect answers. A. Administer an antipyretic medication. Antipyretics may help with symptoms but will not address the underlying infection, which requires antibiotics. C. Increase the TPN infusion rate to flush the line. Flushing the line will not resolve the infection and may cause further complications. D. Apply a cooling blanket to reduce the fever. Cooling blankets may provide temporary relief, but they do not address the cause of the fever. CliniqueRN Test Day Tip. For patients receiving TPN, always monitor for signs of infection, particularly with central lines. Blood cultures should be obtained immediately if a fever develops to guide proper treatment. How did you do? Great job. Click the card above to join our free NCLEX Practice Challenge. Don't forget to like, subscribe, and hit the bell for more. You got this.